Welcome. Today we'll be discussing how to use proper body mechanics in home care. Back injuries make up half of the common disorders among healthcare workers. There are many hazards that can lead to hurting yourself in home care. Some of these are listed on the screen, such as having poor posture or moving wrong with helping our clients. Knowing about body mechanics helps us prevent being injured.
So first, let's define some of the terms. Body mechanics is the way that your body moves together. When you're using good body mechanics, you can save energy, prevent injury, and allow you to effectively push, pull, and lift objects or people. When you're using good alignment, you're making sure that your body is aligned correctly, that when you're standing or sitting or lying down. That means the two sides of your body are a mirror image of each other. When body parts are lined up naturally, you can make sure that you can lift the object that is directly in front of you, making sure that your feet and body are facing towards the object and not away from them, and that your waist is not twisting away from the object. Making sure that you have a good base of support has to do with your feet. Making sure that your feet are far apart will make sure that your base is wider and also more stable. Your center of gravity is the point where most of your weight is concentrated. This is the point is dependent on your position and how stable your body will be, and if you're working your muscles more than you need to be. Making sure that you're losing the lower muscles of your body and your legs will help you reduce strain of your body and making you more stable when making lifts or transferring clients.
There are several rules we need to follow for using good body mechanics. We have listed the 10 most important on the next two slides. First, no, you must use your brain first and always think before making a move. Always assess the load, making sure it is safe for you to move. Think ahead and plan how you are going to move the object or person. Always communicate with your client before assisting them with moving. Always make sure your path is clear of objects. Check your base of support. You do this by making sure your footing is firm and wide, but also balanced. Face what you are lifting. Your feet should be facing the direction you are moving. Move your body as one unit and keep your back straight.
As we mentioned, you do want to make sure that you keep your back straight. Keep your head up and make sure that your shoulders are back and in a proper position. Make sure that you put yourself in a squatting position by lifting with your leg muscles, which are the stronger muscles in your body. Bend at the hips, keeping your knees bent, and then pushing your butt back when you're making a lift or transferring a client. Always contract your stomach. This will lessen any stress that is on your back and help you with lifting the object in front of you. Keep the object close to your body. This will decrease the lever of your arm and also just decrease any stress on your back. Make sure that you're not twisting. You always want to turn and face the object and then move the object with you instead of twisting your body or at the spine. Always choose to pull or push an object rather than lifting it. This will be much less of gravity for you to overcome and also decrease any stress on your back as you're moving objects. So we use the principles of body mechanics every time that we're doing caregiving, such as lifting heavy objects. Make sure if you're lifting a heavy object from the floor that you spread your feet wide and apart and bend at your knees. Use your stronger muscles, such as in your legs and thighs and upper arms, when you're lifting an object from the floor. If you're helping one of your residents or clients sit or stand or walk, make sure that you are supporting your client by using your good stance and your base of support. If your client starts to fall, you never really want to help them by catching them from falling. You always want to try to guide that client to the floor into a safe position. You're never ever going to be in a good position really to catch your client or to keep that fall from happening a lot of the times. So really what you want to do is guide that client safely to the floor just to prevent injury. A lot of times during caregiving, we are required to do a lot of bending. So you always want to make sure that you're using good stance when you're doing this. And if you could prefer, you want to make sure that you are bending at your knees rather than at your waist. If you have to make a bed, for example, you want to put one knee on the bed, lean in and make sure that you're kneeling to support your body rather than bending at the waist over any objects. This will help protect your back and make sure that you're using the correct muscles to prevent any injury.
Here are some frequently used tips to keep in mind. Keep your back straight. Squat instead of bending. When standing for long periods, stand with feet apart and one foot slightly forward. Use both arms and hands when lifting, pulling, pushing, or carrying objects. Hold objects close to you when you are lifting or carrying them. Push, slide, or pull objects rather than lifting them. Avoid twisting the waist. Instead, turn your whole body. Your feet should point toward what you are lifting. Never attempt to lift an object or a client that you feel you cannot handle. Thank you for watching and make sure you complete this month's quiz.